Welcome, everyone. And thank you so much for joining Garrison Institute's forum conversation. My name is Amy. Before we begin today's session, I'll go over a few logistical items. We're on a Zoom webinar, so participant audio and video are off. We will reserve time for questions. Please post your questions in the Q&A panel, which is accessible at the bottom of your screen by hovering your arrow over the Q&A button. You're welcome to post your questions at any time, and we will read them when we get to the Q&A portion. We're on for an hour today, and we'll respond to as many questions as we can. Please forgive us if we're unable to get to your question. The recording of this conversation will be made available on the Garrison Institute website. Please note that the Garrison Institute offers these sessions free of charge as a goodwill gesture to support our community during such times of heightened uncertainty. Donations of any amount are welcome. And now, Mark Greenberg will be moderating this conversation, and I will pass it over to him. Thank you.
Thanks, Amy. It's my pleasure to moderate the Garrison Institute Forum on Education, a conversation with Christa Turksma and Tish Jennings on cultivating awareness and resilience in education. Although the need to focus on teacher resilience and well-being is a long-standing issue and one that all three of us have been involved in for many years, it's especially acute now with the impacts of COVID-19, the pandemic, the uncertainty about returning to school, the emotional burden that teachers have given their concern for their own families as well as their students and their students' families. So let's start with introductions. Christa Turksma is a child clinical psychologist. She received her training in the Netherlands. Before becoming a psychologist, she was a kindergarten teacher and then a principal. She's worked in various research and intervention projects, including the Fast Track project in the United States. She began providing training in the PATHS curriculum in 1988 and has trained thousands of teachers in the US, Canada, the Netherlands, throughout Europe and Australia. Chris is the co-developer with Tish of Care for Teachers program, and she coordinates all workshops and certification of new facilitators. Welcome, Christa.
Thanks, Mark. And I'm really happy to be here with all of you and talk a little bit more about the importance of taking care of our educators and tell you a little bit more about the CARE program.
Great.
So
Great.
I would like to introduce Tish, my co-developer.
Great. So Tish is an internationally recognized leader in the field of SEL and mindfulness. She's a professor of education at the Curry School of Education and Human Development at University of Virginia. Her research is particularly placed an emphasis on teacher stress and how it impacts the classroom. And she's been the primary lead researcher on the work studying the CARE curriculum. She's the author of numerous journal articles and books, including Mindfulness for Teachers, The Trauma Sensitive School, Compassionate Teaching, and Teacher Burnout Turnaround. So welcome, Tish.
Thank you. It's really great to be here. I'm really looking forward to talking to you more about primarily the research that we've conducted on the CARE program today.
Great, great. So we thought we would begin by grounding us to be all present at the beginning of this discussion, and we thought we would do that by having Christa engage us in a short practice that actually comes from the CARE curriculum. So Christa, I'll leave that to you.
Thanks. Yeah, so it's late in the day already, and for most of us, we already had a full day. And so you might feel your body sitting in a chair, but your mind still might be with whatever happened today. So to give us all a chance to be really here and present, I would like to invite you to do a breath practice with me. And for this breath to be really beneficial, it would be good to sit in what I call a mindful pose. So see if you can find a position in your chair that feels really comfortable, but also keeps you alert. It would be good to put your feet flat on the floor so you feel the bottom, you feel grounded and centered. If you like, you can close your eyes or maybe have a soft gaze downward. And your front is open, your back is straight but not rigid. Maybe you want to roll your shoulders a little bit. And I would like to invite you to put your hands on your abdomen so that you feel when you do these 3 deep diaphragmatic breaths, that on the inhalation, your abdomen expands, and when you breathe out slowly, your abdomen goes down. So let's take 3 of those deep, in through your nose, out through your mouth breaths. Thank you. You know, we know through research that this kind of breath really calms down your heart rate, it calms down your nervous system, and it really gives us the opportunity to be present. And the beauty of this breath is that we have this with us all the time. Whenever we need to gather ourselves a little bit or give ourselves the ability to be really present, this is a really good practice. It also gives us the chance to have a pause. When we take that long, deep breath, we can then, calm ourselves down, take a step back and look at a situation with fresh eyes. A very beneficial practice. So thank you for doing that with me. So Mark, I give it back to you.
Great, thanks, Christa. So this is an example of the very practical nature, I think, of the CARE program, because it's really developed to be used with teachers in a way that is not sitting on a pillow, but really allows them to be present as they're working. And Christa and Tish, you're really pioneers in the development of adult SEL and well-being. I thought we'd first talk about how this began and the role of the Dalai Lama and the Garrison Institute in the development of CARE. And if you don't mind, let me begin about its early origins. This really began at a meeting in Dharamsala with the Dalai Lama, a Mind and Life meeting in 2000 that was called Destructive Emotions. It was the end of the second day, the middle of the second day, and Richie Davidson and I and Paul Ekman and Alan Wallace, so a neuroscientist, an emotion researcher, a child clinician, and a Buddhist monk. We're sitting together on a couch. Sounds like a joke, doesn't it? His Holiness turned to us and he looked directly right at the 4 of us and said the following. He said, if we know so much from the West about emotions and about relationships, and we know so much from the East about the nature of the mind, why isn't there a secular program to help people become more aware and compassionate? And he said, especially for those who help others, for caregivers. It was a great question, but it was more than a question. It was clearly a direct request from His Holiness to get started on a new project. And that night, we stayed up much of the night, started to think about a project that then began in San Francisco, was focused on educators. It was first led by Paul Ekman and then by Margaret Kemeny. And it's interesting because Christa and I were together at the Dharamsala meeting, and we'd just been talking about how we could better support teachers. I was talking about what I call windshield work, which is how teachers, when they drove to their school, could just take a moment or two and pause and hold on to the steering wheel with the engine off and reflect on what they wanted their day to be like. And we were starting to talk about ideas like this. And Tish, this is when you and I met, because this project called Cultivating Emotional Balance in San Francisco is what brought us all together. So how about if you take it from there?
Sure, yeah. That was the first time I met you both was in San Francisco. I had learned about this meeting that had happened and then the subsequent study. And I had been always concerned about teacher stress, and I had been practicing my own mindfulness practice for a long time, and I knew it had helped me, but I wasn't exactly sure how to go about doing the kind of work that we've done since then. So I found out about this study going on in San Francisco, which wasn't far from where I was living, and I had to work on it because they had chosen teachers to participate in the study. And they were going to test this program called Cultivating Emotional Balance with this group of teachers to see if it reduced their stress. And it was a very complex study because it involved 3-hour laboratory assessments of the teachers, and they looked at their biological markers for stress. It was a very complex study, but I had the wonderful opportunity to participate in all the training sessions. And my question, though, was, does CEB improve the way teachers work in the classroom? Not just does it reduce stress, but does it actually improve the way teachers interact with their students, the way in which they create an environment that's conducive to learning? Does that happening? And I was fortunate to get an award from the Mind and Life Institute to study that question in a little pilot study. And then I got a grant to do a larger study to look at that more deeply. And what we found was that even though it did reduce stress, it didn't improve the kinds of behaviors in the classroom that we were looking for. So then I started working at the Garrison Institute, running the education initiative. And they asked me to create like a pilot project. And my first thought was, I've got to create a program that will do what I'm hoping. And it's probably similar to Cultivating Emotional Balance, but it needs to be more specifically directed at the stressors that teachers are experiencing. And so I got to know Christa, and I also got to know my friend Richard Brown, who's at the Naropa University. And I invited them to join me in the process of creating this new program. Originally, we called it ACT. I can't even remember what that stands for, but we found out soon enough that there was another program called ACT. So we came up with this name, this acronym, CARE, Cultivating Awareness and Resilience in Education. And since then, we've been doing lots of trainings and lots of research, which I'll talk about more in a little bit. Thanks.
Great. Thanks, Tish. So the Garrison Institute was really central to the development of CARE. And so it's wonderful that we continue to do retreats there and have a long-term partnership with Garrison. Christa, both you and Tish were classroom teachers, and I'm wondering how being a teacher affected your interest in how it affected the evolution of CARE.
Okay. So as you mentioned before, I started out as I'm not seeing myself. Yeah, I'm on? Okay. So I started out, as you said, as a kindergarten teacher in the Netherlands. That's where I was born and raised and got my education. And I really always loved that age group, still do the enthusiasm, their curiosity, their energy, their willingness to learn new things. And I thought it would be great fun to be a kindergarten teacher. So I did it for a couple of years, and it was a lot of fun, but it was also a lot of work. So although my students still had all the social and emotional skills that we, oftentimes now have to teach our students, there was always one or two that needed a little bit more. They had a little bit more emotional problems, behavioral problems, and I didn't feel I had the expertise or the skills to give them what they needed. So I went back, got my degree in child clinical psychology, but really focusing on children with emotional and behavioral problems. And really my interest was in Rogerian play therapy, because I still feel to this day that play is the way that children learn. So after I graduated, I got a job as a play therapist at a school for the deaf, and that's how I got in touch with the PASS curriculum. And the PASS curriculum is really a social and emotional learning program that teaches children about their emotions, how they are feeling, what are the physical symptoms, how can they become a good friend, how can they really develop good relationships, and how become good problem solving skills, lifelong skills for a successful life. So when I moved to the States in '87, I started working with the PASS curriculum in many schools and abroad, as you said. And over time, working with so many teachers and being in so many schools, I became more and more concerned about a teacher's own well-being. we have not paid attention to the impact that teaching has on teachers, but also how the teacher's own well-being affects a classroom full of students. So when Tish started working at the Garrison Institute and the three of us got together, we really wanted to create a program that supports the teacher's own well-being, because in my opinion, although teaching is the most rewarding job, I know from experience it can also be so stressful, but that teacher is the most important person in that classroom. And if he or she is not doing well, nothing in that classroom runs well. So we really wanted to develop a program that supports the teacher.
Great, great. And Tish, can you speak to the issue? You were a teacher, both a Montessori teacher and a teacher supervisor. I'm interested in how your experiences helped shape the way you thought about teacher well-being and the development of care.
Yeah, thank you. I think the most salient part of my experience that contributed to wanting to understand this better was observing student teachers. I supervised student teachers as part of a teacher ed program, and I taught the same teachers classroom management. So I had an opportunity to watch the students that I had trying to deploy skills that I had been teaching them about managing behavior. And I kept seeing their emotional reactivity interfering with this process. And I understood it because I've experienced it myself. You're trying to juggle all these things. You have all these demands going on, and somebody does something that interferes with what you're trying to do. And it's easy to get distracted and upset, and sometimes take it personally and then respond in ways that aren't going to help the situation. So I kept seeing that, not only in the novice students, but also in their supervisors. So I started thinking, what is going on here? Why is this so hard? Because the other part of it that was frustrating was when I would talk to them about it, because my job was to coach them, they didn't recognize what was happening. And then I thought, whoa, this is really interesting. How can we fix this if we can't even identify it? And so when I started learning about the destructive emotions meeting and the work that Paul Ekman was doing in UMark, I started thinking, there's something about emotions, there's something about stress that I need to understand that will help me make sense out of what I was observing. And so that's what prompted me to go back and get my doctorate in human development, where I focused my studies on stress and coping.
Great. So adult SEL is now a very, very popular topic. We've been waiting for years, I think, the three of us, for people to start to talk about the issue of adult SEL seriously. As one superintendent said to me many years ago, he said, "The problem in my district is not my students, it's me and the staff. We don't understand ourselves very well." And so, Christa, I think you would probably agree that doing an hour or two of adult SEL is not going to solve this problem. And that's why CARE goes into depth on the issues of teachers' awareness and well-being. Could you talk a little bit about both the goals of CARE as well as its components?
Mm-hmm. So as I said before, our goal is really to support the teacher's own well-being, and to increase their ability to be present in a classroom full of, living, thriving beings, to create really those satisfying relationship, not only with the students, but also with your colleagues, so that you can have a supportive team around you. And to, we become teachers because we want to instill that love of learning. So we want to create environments where the students thrive and where you instill that love of a lifelong learning. So everybody thrives. That's really the goal of CARE, that we want to give the teachers the tools to deal with all the demands on their plates in a way that is less stressful and doesn't lead to burnout. So how do we do this? Well, we introduce about 13 different skills. And you know that when you talk with teachers, the first thing a teacher will tell you, I don't have time. So we needed to be very practical. So one of the first things we introduced is what I did with all of you in the beginning, is to introduce that practice of taking a long, deep breath when you need to gather yourself and you need to give yourself that ability to synchronize your body and your mind, to take a step back, look at the situation with fresh eyes. And teachers have told me over and over how beneficial just that easily incorporated skill is in the daily lives. And another one is to set a daily intention. So we ask teachers to reflect on, why did you become a teacher? What are the values that really supported this decision and still support you? And then what is your vision of yourself, of a teacher? And of course, most of us as educators, we want to be kind and caring and compassionate. But sometimes, you know, when we are stressed out, we feel so far away from that vision that we have of ourselves as caring people. So setting a daily intention, it's like a compass. It keeps us more in alignment with how we want to be. And again, it's a very easily incorporated skill. And teachers have told me how those two skills already are very beneficial. And another really important component is the cultivating emotional awareness, because by definition, teaching is an emotional job. We are dealing with emotions all day long, our own, those of our students, and it can be pretty exhausting. So cultivating a better understanding, how am I feeling? Why am I feeling that way? What pushes my buttons? What gets me really hot under my collar? Becoming aware of the physical sensations when I have an uncomfortable feeling, like if I feel anxious or nervous. You know, when I was still doing PASS and I was doing a lesson on feeling anxious and nervous, one little first grader said to me, she says, "Mrs. T, have you ever felt like ants are crawling in your stomach?" Now, isn't that a beautiful description, what it feels like when you feel nervous and anxious? Now, if we pay attention to, oh, the ants are crawling in my stomach, and usually that means I'm feeling anxious, then you can also become aware of the thoughts that usually feed those uncomfortable feelings. And if I don't pay attention to how I am doing, I might transfer my own unease on my students, on my audience. Instead of, at that moment, I can take that long, deep breath, calm myself down, and say, okay, I am feeling nervous. Mark, I see a very concentrated look on your face. Do you have a question? So I can respond instead of habitual reacting. And another very important component is to teach teachers a different way of listening. What I call listening with our hearts instead of with our head. You know, as educators, we all learn the skills of active listening. And if we would really apply those skills, that would be great. But usually active means that we're very active in our own mind. When we listen to somebody, we listen to have an answer, because, you know, as teachers, we are problem solvers. So how am I going to solve this? What am I going to say? Instead of, again, just listen and give the person, the speaker, the ability to tap in their own wisdom. Because how many of us have had the experience that we wanted to talk to somebody just to get something off our chest, to get some clarity, and they start giving you advice? That's not what we wanted. We just wanted somebody to just listen. And our students are not different. They sometimes need just that sounding board. It's not an easy skill. It sounds easier than it is. So we do several practices. And then we want to really also focus on compassion. Teachers have a lot of compassion for their students, for the parents, but it can be very, very difficult and hard on themselves. So cultivate a more compassionate attitude towards yourself. So we do a listening exercise where we have them think about a time when they talked to a friend about something. And how did the friend talk to them? So to teach them to talk to themselves as a friend would. So those are some of the techniques that we use in care.
Great, great. Thanks, Christa. And, this is all part of, I think, a model, which is really about the idea of interpersonal mindfulness as mindfulness in action, if you will. And well, of course, there is some meditation practices that are also done in care. I think the primary goal is to be interpersonally mindful in action and present in the classroom. And I think, Tish, this is probably what distinguished it from Cultivating Emotional Balance, which as many teacher programs have just translated a mindfulness-based stress response model and used it with teachers, whereas the care program is really designed by teachers and for teachers, and understanding what it's like to be a teacher, that you're not going to sit for a half hour each morning before you go to work. It's just not, it's not realistic in the lives of teachers. They're extremely busy. And that led us to think about the research issue. So Tish, could you talk about the evolution of the research on care?
Sure. So previous to being at the University of Virginia, I was at Penn State working with Mark. And we wrote a few grants to see if we could get some funding to explore care and the effects of care on teachers' well-being. We received one of the first grants from the Institute of Educational Sciences, the US Department of Education, to study care, to study a mindfulness-based program for teachers, basically the first adult SEL program to be ever studied. And we found wonderful effects that provided us the data that we needed to get funding to do a very large randomized trial, which we finished in 2017. We studied 224 teachers in New York City, in the Bronx and Upper Manhattan, in 36 elementary schools. We randomly assigned them to be in the care group, to receive the care program, or to be in a waitlist control group. So they would eventually get it, but not at the beginning. And we looked at, we collected self-report data from teachers, but we also observed their classrooms and rated and coded their behaviors, the interactions in the classrooms, to see whether or not care might impact those interactions. Finally, we also had teachers report on their students. So we collected data on 5,200 students. And so this was the largest of its kind ever, a study like this. And we were very excited to see that we improved teachers' well-being. We reduced psychological distress. We reduced something called time urgency, which is that feeling that you don't have enough time. And when I was teaching, that was something I felt a lot, because I was always looking at my watch, looking at my lesson plan. Am I going to get through this? And what we found was that care really helps teachers manage that stress, calm down, because sometimes when you get in that state, it's hard to work. So it's hard to get things done. They reported to us that they feel more productive because they're actually being present instead of worrying about everything they have to do. We also showed improvements in mindfulness and emotion regulation. This was all the teacher self-report. We also showed improvements in classroom interactions. Overall, the care classrooms were more emotionally positive. And the way this looked was the teachers were more sensitive to the needs of their students, and their classrooms were more emotionally positive than the other classrooms. Finally, if you looked at the students and the data on the students, overall, they were more engaged, which makes a lot of sense. But when you think about a study like this that is targeting the teacher, it's not teaching the teacher to teach differently. It's not providing a new curriculum. To see impacts on students is pretty amazing. These are like downstream effects. So we were excited about that. But the thing that was really exciting was if you looked at the students who were low in social skills at the beginning, they improved in motivation and reading competence. So it did have not only an impact on the students' ability to engage and be motivated, but also their reading competence. So that's really exciting. The other final study we've done so far on that project was we looked at the long-term impacts of care, and we found continued improvements in emotion regulation and psychological distress, even after a year later. So these were long-term effects, not short effects. Thanks, Mark.
Great. So we're really building in protective factors. And of course, it seems common sense to us, and it even did from the beginning, I think, that when teachers are well, they're going to teach better. And when they teach better, children are going to become more involved. The classroom is going to become a more loving place. Children are going to be more attentive. And as a result, they're more likely to learn. And I think it's especially the case for kids that are at risk. And that's what we found in the New York study. We have wonderful colleagues in that study, Josh Brown and Deb Schuessler especially. And if you go on the CREATE website, you'll find copies of articles, both qualitative and quantitative articles on that large randomized trial. And that really led to the development of CREATE, the nonprofit that now is the home for care training, because once we were able to demonstrate through a series of randomized trials that care was effective, we needed to then carefully develop a training organization that was had fidelity to the structure of care and the way it was done and carefully tested that showed these results. And more recently, just published is a new study that was done in Croatia, a randomized trial of care in Zagreb, showing quite similar results, as well as some new effects on self-compassion. Christa, care retreats have been provided at Garrison for, I think it's now 13 years, but care is also provided in school districts around the country and other places. Can you tell us a little bit about the extensive nature of care's reach?
Yeah, so right from the start, we started with annual retreats at the Garrison Institute, which are always wonderful. And we started out usually with 5 days, and now we do it in 4 days. But I felt that I also wanted to create a model that would be useful in what I call in the field, so working in school districts. And that's what we have been doing over the last 10 years, developing, models for implementing it in the field. And we have worked with a district in Chicago, with the Cleveland district, with Baltimore, with Harrisburg. And not only, with school districts in the States, but as you already mentioned, we also have done workshops in other countries, in Croatia, in Argentina, in the Netherlands, which I was very happy to do it in my own country, in my own language, in Germany, where we did care with refugee teachers, and in France just recently, where Tish went last year and did it in Paris. So when we do the care workshops, we also use a workbook, and the workbook is now translated in Dutch, in German, in French, in Spanish, and we have some facilitators who also work in China, and it's also translated in Mandarin. So we have done care workshops with private schools, with public schools, with after-school programs. We have done it, the participants were either, preschool teachers up to university level. And the last couple of years, more, like I became so concerned about teachers' well-being, doing these care workshops, usually we do not invite the principals or administrators or anybody in a supervisory position together with teachers, because we have found through experience that it's not a good combination. It's too much of a power difference and nobody really opens up. But over time, I then became really concerned about those people because they need it as much. And principals have told me, they feel caught between a rock and a hard place. They have pressure from the top, they have pressure from the bottom, and there's very little in their professional development that focuses on their well-being. So I have now also developed, an adapted version for principals.
Great. And there's actually some published qualitative research by Julia Mahfouz on that I believe is also referenced on the CREATE website. We have a question. I thought maybe we'd take a question right now. It's related to this. And I think, Tish, I'll ask you about this question. It's from Laura Reardon. She asks, have you used CARE with pre-service teachers and what was the impact? And since you've been doing so much pre-service work with teachers, tell us a little about your experience.
Well, I've learned from various experiences, and I can tell you about two of them quickly, that it requires a really different approach for a pre-service. We did a pilot study in State College, where Penn State is, with in-service teachers. I think the mistake we made for that study was we invited their supervising teacher to join the training, which meant that they were in the same group with their supervisor, which kind of created some tension or resistance to expressing feelings, and some discomfort, I guess I would say, and also maybe a little bit of confusion, because I don't think they quite really understood the kinds of stress that they were going to be facing as a teacher. And that's exactly what I found when I started teaching in the pre-service program here at the University of Virginia, and trying to introduce it as part of a classroom management class, because I went back and started teaching classroom management again, and I thought, oh, good, I'll try this again. And they were somewhat resistant. And I think it was mainly because they didn't quite understand the stress. And I had some feedback from somebody once who told me maybe in order to get them to understand the need for it was actually triggering some uncomfortable feelings about becoming a teacher, because it was feeling like, oh, this is going to be so stressful, will I be able to do it? And so one of the things we started doing is a new program that teachers, candidates can take as an elective, that is a mindfulness-based program, but it's not like CARE in the sense that it doesn't talk about teacher stress. It teaches the skills outside of the context of the stress as a way to prepare them, and so that it doesn't frighten them. And the teachers we've taught in that program seem to love it. So I think you just have to make sure you don't connect the stressor with the pre-service teachers, because it will frighten them and they will resist it. At least that's been my experience.
Yeah. Tish, one of the reasons for programs like CARE is of course to support the well-being of teachers, but you and I both hypothesize, and Christa, we've talked for years about that focusing on teachers' own SEL should also have an impact on the quality and implementation of SEL programs in the classroom for kids. And could you talk about the new Catalyze study?
Sure. Mark and I for years have been talking about how it would be so exciting to see if CARE improved teachers' delivery and the outcomes associated with a good social emotional learning program. And we were very fortunate to be funded to answer this question. And we are doing a large study that we've called Catalyze. We're calling it Catalyze because it's bringing together these two programs to see if it has a catalytic impact, CARE and PATHS together. And we're doing it in the Chicago public schools with elementary schools to try to see. And so a lot of schools in Chicago already have PATHS because of other projects that Mark has done there. And so we've recruited some of those schools for this coming year because this is such an odd year. And we randomly assign some of those schools to also get CARE. So all of them have PATHS. And then we're adding the CARE to that to see if CARE makes a difference in the implementation of PATHS, the outcomes on the students, and also the teachers, like the impact on the teachers too, because Mark has found in the past that SEL programs like PATHS can actually have positive impacts on teachers as well. So it'll be interesting to see how these two work together. The following year, we will expand our sample, hopefully when COVID's over, and be able to really do the full study next year, but we're excited about it.
Great, thanks. Because the issue in the long run is to create really a systemic model of SEL. We're not just talking about a child curriculum or adult SEL or policies and practices, but instead, how do we create a systemic model across districts and schools it really makes a kind of caring, healthy schools for everyone that all of us really yearn for. And that's why we developed the Create nonprofit, is to both to create with fidelity these teacher programs, but also to do systemic SEL planning with districts, so they think about how to become broader in their thinking about how one can create a caring school. This year, because of COVID, face-to-face retreats for care will not be held at Garrison, but instead there'll be a new type of training, an online virtual training. Christa, can you tell us a little bit about it?
Sure. So although Tish and we never wanted to go online, we feel very strongly that this is really best done in person. Like all teachers, we needed to adapt to a new normal. And so when the request came, can you do the retreat this year virtual? I have now developed a 3-day model for August 3, 4, and 5. But, also, again, to be really practical, knowing that teachers are still home, still sheltering, we didn't feel that it was very beneficial to do a whole day. So we divided the day in 2 2-hour sessions, one in the morning and one in the afternoon, with some assignments for the teachers in between.
Great. Well, I'm sure, we all mourn the idea that the face-to-face training can happen, but the virtual training will allow people from all over the world to participate in a way that wasn't possible before. And so I guess we could maybe call that a silver lining of this virtual training, is the ability to bring together people that otherwise would never have been able to access it. And I believe that in the chat, you can find information on registration, et cetera. We have a bunch of good questions. One question, maybe directed to Christa, is how can one get the care training for administrators?
Yeah, so you can contact me. And, what I usually do, I have a conversation with you, and a full care workshop in general is 3 days. And that, sometimes is difficult for administrators. So I will have a conversation with you about, what is possible, how much time can you give me, and I will adapt the program to, be as implemented as as best as we can be. So the same way as if you would like a care workshop for your teachers, you would contact me, and we would have a discussion about this. I don't know if that answered the question right, but
yeah. One of the attendees asked the question about what are some of the new stressors and strategies that have been used to help teachers during COVID? And one thing I might direct them to, Christa, is the 1-hour webinar that you, I, and Velma Cobb did earlier this year as part of the Castle Cares webinar series, in which we did practices basically for an hour with teachers that are at home right now. But I wonder if either you or Tish would like to elaborate any more on the strategies that have been used to help teachers during COVID.
Well, in addition to this 1-hour webinar, I had a request from an after-school program in Philadelphia. So for them, we did a 4-hour, four times a month-long 1-hour webinars, and we really focused more on the positive, cultivating our positive emotions. And of course, we talked about, how are you feeling? How are you dealing? What are your coping strategies in these times? And how important it is to really focus on anything that gives you joy, but also to create more a feeling of gratitude, that even in these days, even in these stressful times, there are still so many things that we can be grateful for. And then what some of the people do, they start a gratitude jar, where they have either with their family or they do it with their students, where they have the family members every day put something that they feel grateful for in a jar, and then at dinner time or lunchtime, you know, everybody can pick something and read it out loud. So really, you know, focusing more on that, you know, feeling nervous and anxious and worried is normal in this time. But also knowing that when we feel that way, we cannot make good decisions. We cannot be there for our children. We cannot really be there for our students. So what can we do? What else can we do to focus, you know, our attention on something that gives us more joy, that gives us more fulfilling? And one thing is, you know, maybe turning off the news for a while.
Yes. Tish, anything to add to this?
Yeah, I've been doing a few workshops on this topic as well. And the thing that I find, I totally agree with everything that Christa said, and I have said the same things, but I just want to add that the self-care is something that is more important now than it has ever been, because of the added stress. We already had stress, and now we have all this uncertainty. And so it's totally normal when you're living under this kind of uncertainty to feel stress, and giving yourself some extra time to take care of yourself, and really examining how you're doing that, and making sure that you're covering all the bases. You're taking care of your physical well-being, you're taking care of your social interactions and well-being, and keeping connected socially, even if it has to be virtually, and remembering to appreciate the things in your life that are going well right now, instead of focusing too much on the news or on the problems that are happening.
Well, let's take two more questions if we can before we do a closing practice. Someone just asked a very thoughtful question, which of course we all have been talking about, and that is the issue of unconscious bias and equity-related issues in the emotional awareness training. And of course, Christa, you were doing these workshops with an urban population right as the George Floyd murder happened. And one of the important issues here, I think, is the work you do on emotional awareness and on scripts. I wonder if you could maybe talk a little about the issue of equity and recognition of unconscious scripts.
Mm-hmm. Yeah, so that is a really important component of care, is to become aware of our, you know, implicit biases, our implicit scripts. We all do have scripts, you know. Throughout our lives, we have experienced positive, negative, and they color how we see the world. They color our beliefs, our values, and in care, we really want to cultivate a better understanding, especially about, you know, the biases that might interfere with our connection with our students, with parents, but also with colleagues. So when you have an interaction with somebody, or you have a difficulty with somebody, can you take a step back and look at, you know, what might be a script that I have about this? So, you know, I often give the example of my own experience growing up. You know, I had a father who had really angry outbursts, and that frightened me a lot as a child. So I learned to cope by being very quiet around him. But I developed a script that loud male voices are dangerous. So it triggered in me the feeling, okay, I'm in danger. So staying under the radar, that served me well as a child. But now I'm an adult. I work at a school. I'm in a meeting. My principal is a male, and for some reason he's irritated and he raises his voice. Now I can feel that same fear reaction come up in me. This script is triggered. A loud, angry voice is danger. So at that time, when I can then take a breath, deep breath, calm myself down, saying, you know, this is not my father, because I know that I have that script. I can take a deep breath, calm myself down, and Now I can say whatever I need to say. But being more aware of what kind of biases you might have, that gives you the ability to change it.
I just want to add to that too. There has been some preliminary evidence that a brief mindfulness practice can reduce implicit bias as measured by the Project Implicit, which is an online tool for measuring implicit bias. And I have a doctoral student right now, Pam Nicholas Hoff, who's really interested in this. In particular, she's interested in seeing whether care disparities in discipline, especially those that impact African-American boys primarily. And so before COVID happened, we were designing a really interesting study, that experiment, which now we're not sure we can do, but she instead is starting to look more carefully at archival data to examine this. But that's an area that we're starting to explore and trying to figure out how we can study that.
I guess we're also hoping that as a result of this developing awareness of teachers, that they'll take less personally, but take more seriously the issue of structural racism and the understanding of it. And that's important, I think, in the work that we're doing. One last question is a really interesting one. It's one we all struggle with for years now. And that is, to the extent, do you believe that programs such as care should be mandatory? Benefiting from mindfulness requires an open mind. So the people who need it most may be the most skeptical. Have you encountered skeptics who eventually bought into it? And if so, how did that happen? And because we've been working in whole schools, of course, at Garrison, teachers are volunteers. They come because they're intensely interested. But when we walk into an entire school to do care, it's a very, very different context. I wondered if either Tish or Christa would like to comment.
Well, you know, when you work with a whole school where you get professional development days, you get everybody. And you have to know as a facilitator from the beginning that there's going to be some resistance. And so what I usually do, I just open it up. And I say, I usually will say something like, you know, this might not be everybody's cup of tea, but what I invite you to do is keep an open mind. And my experience is that most of the resistant people stay in. They might not all practice the skills that we implement, but I would say most of them come kind of around.
I believe from a research standpoint, we've found that there are very few baseline predictors of how often teachers will practice. For example, in the New York study, I think it was about a third African-American, a third Latinx, Hispanic, and a third Caucasian teachers. And there were no differences in either outcomes or in the amount of practice. Nor did I think baseline mental health predict their outcomes. So my sense is that while people begin often skeptically, it's not a good predictor actually of how much uptake they'll have. And we found this for social emotional learning in general. Sometimes the teachers who are most skeptical end up being the best because they're skeptical, because they're experienced, they know what they need, they know what they want. And most professional development is not very interesting to them. And so if they get professional development that's actually useful about their own self, their own life, they often come together as a community in a way we wouldn't expect.
I think also we've seen a huge change since we first started doing this, just because now mindfulness is more accepted and people recognize the value of it. And so you don't feel like you have to make that case so much anymore. So yeah, we do run into it every once in a while, but it doesn't seem to be a big issue.
Great. Well, good. I know we're getting towards closing, Tish. I wondered if you could do a closing practice with us.
Sure. So as Christa was describing the importance of gratitude, I thought it would be a good time for us to focus on that. One of the things we do in care is learn how to generate feelings that are comfortable. It's really easy for us all the time to start to feel uncomfortable. Our nervous system is really good at that. And we have something called a negativity bias. So there's a tendency to focus on the negative. It's just a normal human tendency. So sometimes we have to take extra effort to recognize and savor these comfortable, enjoyable, pleasant emotions. And gratitude is one of those. So I'm going to invite you to close your eyes if you'd like, or just lower your gaze, getting into that mindfulness posture that Christa described before, and close your eyes if you want. Take a breath or two to get settled. And then take a moment to focus on one thing that you feel grateful for right now. There's probably lots of things that you can feel grateful about, but for this practice, just choose one. And imagine yourself in experiencing whatever that is that you're grateful for. Grateful for your home, for your family, for whatever it is. Imagine yourself experiencing that. And notice yourself feeling gratitude. Notice what gratitude feels like in your body. Notice where you feel it. How does it show up in your body? Once you have a good sense of this feeling of gratitude, see if you can savor that feeling, allowing it to soak in. Imagine that you're tasting it like some delicious food. And really sit with it and enjoy it. And then take a moment to recognize that you were able to bring this feeling into your body all by yourself by just thinking about what you're grateful for. And when you feel ready, you can open your eyes.
Great. Thank you so much, Tish. And we're wishing everyone health and safety in this time. And I think I'm turning it back over to Amy.
Thank you so much, Mark, Christa, and Tish. I'm just coming out of my nice gratitude meditation. And thank you all for joining us today. Again, Carol will be offering a virtual retreat August 3rd through the 5th. We posted the link in the chat box, and registration can be found at garrisoninstitute.org. Please join us again this Thursday, July 16th, for another Garrison Institute Forum series with Ed Norton, live in conversation with Jonathan Rose. Please keep checking garrisoninstitute.org for updated listings of future sessions and to view the recording of this webinar and others. All of these sessions are free of charge. If you would like to support this programming, please consider making a donation at garrisoninstitute.org. And may everyone be happy, healthy, and safe.